Hey everyone, Holly here. I'm a functional nutritionist and gut health guru. I do have degrees in both nutrition and psychology, so I'm a bit of a science nerd and I love diving into the research to bring you actionable strategies that you know are going to work for your gut health. Today I want to talk about why your doctor is failing you in terms of helping to both figure out what's wrong with your gut and actually give you solutions that work. So I'm willing to bet that you are struggling with your gut and that you've been to your doctor, they've done a number of tests, maybe they've done blood work, colonoscopies, endoscopies, all kinds of tests, and they basically told you that you have IBS because they can't find anything actually wrong with you. IBS is basically a wastebasket category where the doctor's like, look, we've ruled out all kinds of serious illnesses. You don't have colon cancer, you don't have Crohn's or colitis or celiac or any of these other more serious bowel issues. It's a functional disorder, meaning your gut is not functioning optimally. So we're just gonna tell you you have IBS because that's a dysfunctional gut, basically. And maybe they give you a prescription for an antacid, or they give you a prescription for an antidepressant, or they give you a recommendation to try a probiotic. And I'm willing to bet that you've probably tried any and all of these things already, or maybe even if you're struggling with constipation, they've given you something called Linzess, which is a prescription laxative, basically. So now good luck going anywhere without pooping your pants, right? The reason that doctors cannot help people with functional IBS type issues, so gas, bloating, constipation, diarrhea, heartburn, indigestion, is because they are functional disorders and they are not trained to optimize function of the body. They are trained to diagnose and manage diseases. So if they can't diagnose you with a specific disease, and that disease, once you've been diagnosed, okay, this is the treatment or the management, the drug or the surgery that we give you, then they can do very little for you. So don't get me wrong, doctors are very important at saving your life and managing, serious illnesses. But again, it's management. If you don't fit the criteria for the disease to be diagnosed and then you're given a pill or a surgery, that's all they have in their toolbox, right? They're doing what they're trained to do. And if that's not you and you're not diagnosable, then there's very little they can do to help. So I'm willing to bet that's why you found me here today. And maybe you've already invested in working with a naturopath or another nutritionist or some other kind of functional practitioner. And that's awesome. But sometimes these practitioners are not covering all the bases. So we're going to talk a little bit more about why the Western model of medicine is failing us and what you need to look for when you're choosing a practitioner, a functional practitioner, so you know that you're investing your money wisely and you're actually going to see results. I'm just going to reference my notes here as I go, so don't mind me kind of looking away. So yes, the doctor is trained to diagnose and manage disease. So if your tests come back normal, so say we're talking about a blood test, say they're looking at, I guess if it's not a whole lot of gut tests or blood tests, but as a general example, say you're looking at your iron because you're tired and it comes back normal, right? So it's within the range that a doctor has been diagnosed to say this is a normal range that is absent of disease. You're within the range, but you are right at the cutoff of low. That is not an optimal level for optimal health. But doctors are not looking for that. They just want to make sure you don't have a diagnosable disease. Like if you're in this range, you don't have anemia, you are fine. But you're always tired and you're foggy and your muscles are aching or whatever. You probably do have low iron. Whether or not it can be diagnosed as anemia, when I see someone's numbers at that level right at the low cutoff, I'm going to tell them they need to take iron because it's not in the optimal range. So a diagnosable range is quite large, whereas in functional medicine, we look at the optimal range, which is much smaller. And if you're not within there, then we go ahead and treat you with whatever it may be, diet, supplements, lifestyle changes, okay? So here's the thing. You deserve not to be just disease-free, right? You want to live at optimal health. You want to have energy to do things with your kids and your grandkids and travel and enjoy your retirement. You want to be able to eat the foods you enjoy without feeling bloated and unwell after. You want to be free of headaches and aches and pains, joint pain, and things that are limiting you from doing the things you love. But you're not going to get that kind of health, that radiant, optimal, total vitality by simply relying on what your doctor can do for you. This is where investing with a practitioner, a functional practitioner, is what's necessary to optimize your health to that next level. The other thing is that doctors are not trained to, like I was just saying, they're not trained to optimize the function of your body. So for example, you come in, you've got heartburn. What's the doctor going to do? Well, first off, most doctors in the Western medicine believe that, number one, symptoms are treated individually. So they're not going to look at how stressed are you sleeping well, what's your mental health like, all of these other factors. All they care about is, okay, you've got heartburn, I can give you a pill for that. That's diagnosable basically on the spot. I can give you a pill for that. This PPI, prescription strength antacid. And what they believe, which we know is not true based on research, is that you're having heartburn because you have too much stomach acid. There are very, very few cases where people that have heartburn actually have too much stomach acid. They either have normal or quite low levels of stomach acid. But it's the sphincter between your stomach and your esophagus that's not functioning properly and not tightening. There's not enough acid to tell that sphincter to close, and so whatever acid you do have is coming up into your esophagus and causing that burning sensation. But a doctor is not about to go and order a Heidelberg test, which is an option in medicine. A gastroenterologist can go and order you a Heidelberg test, I believe that's the one, to actually measure your stomach acid and see whether it's high or low. It doesn't matter to your doctor because the treatment is going to be the same. That's all they really have to offer is an antacid, right? Whereas a functional practitioner, a functional nutritionist like myself is going to say, I know odds are your stomach acid is quite low, especially based on your stress level, right? If I can tell and we have a discussion that your stress level is high, anyone who's chronically stressed has very low stomach acid because we know stress shuts down digestion. And I know that that's going to be why they're having heartburn. So we optimize the functioning of the stomach and the gut and bringing up that stomach acid level to a level where it's, first of all, breaking down your food. It needs to be there to prevent bacteria from growing out of control and causing infections. And you need that acid, like I just said, as a trigger for that sphincter to tighten so you're not having things come up into your esophagus, right? So this is where I'm looking at more of the functional piece of what might be deficient or dysregulated or imbalanced in the body, and how can we correct that in a gentle way so we're actually getting to that root cause and healing it rather than masking the symptom with a medication. So if you're listening and you are someone, odds are you're not here because you're this kind of person, but just in case you're listening and you're like, Holly, I just want this pill and I want it to go away and I want to feel better right now, then this is not the place for you. Unfortunately, go see your doctor. The people that come to me are people that are done with the quick fixes because they've tried them and they've realized that in the long term, those quick fixes have made them more sick. There is research to show that taking things like an antacid, an antidepressant, a laxative, what else do doctors give out? Antibiotics. All of these things long-term cause more illness, right? You're going to get sick more often. You're going to have more nutrient deficiencies. You're going to develop osteoporosis. You're more prone to ulcers and infections and things like SIBO, bacterial overgrowth. You're going to develop more and more complications of these medications. So hopefully you're here because you are done with the quick fixes and you want to get to those root causes and optimize the function of not just your gut, but your whole body. And that brings me to my next point here, is that Western medicine approaches the body by systems. That is why we have specialists in gut health, gastroenterologists. We have specialists in immune function, immunologists and allergists. We have specialists in hormones, so what do we call them here? Endocrinologists or internists that work on hormones and things like diabetes and adrenal issues. There's all these specialists, and unfortunately our medical system is not great in communicating between these specialists. So that's a whole other bucket of worms. But the problem here is the reason people end up sicker and sicker and sicker is because they're going to each specialist and getting a different medication for each symptom or ailment. They are not looking at the whole person, both physically, mentally, emotionally. Like I said, that's 3 things. They're not treating you as the ecosystem that you are. You are not a robot. You are not a machine where we can tinker here and tinker there and everything's just fine. By now, you probably realize that tinkering here and there is really just symptom management, which again, that's how the Western medical model works. But when we treat a particular ailment like heartburn systemically or holistically, so we're not just optimizing stomach acid, but we're looking at why is this occurring in the first place? Do you have a gut bacteria imbalance? Maybe you also have motility issues. Maybe you also have low bile from your gallbladder. What's your stress level like? Are you sleeping well? I address all of these factors with my clients to make sure we are taking a holistic, whole person approach, because that is what's going to not just give us better results, but keep you there in optimal health and prevent further illnesses from developing. The issue comes when we start taking a lot of these medications too. They are causing more side effects, right? So people that have been on an antidepressant, not to say that I'm against them, I actually use them myself in my journey, but antidepressants have their own set of side effects, including things like gastritis. They actually act as kind of an antibiotic on the gut as well. So they may be killing off some of that healthy bacteria that you're trying to grow and replenish. And a lot of them can even be constipating. Same with other prescriptions. We just talked about the antacids or things like Linzess for constipation. Now you're having the opposite problem, diarrhea. You're likely not absorbing any of those nutrients from your food, and now you're tired, you're dehydrated, you're getting lightheaded, right? A whole other subset of problems develops when we take these medications. Not to say they should never be used in acute situations. Obviously, if you have not gone to the bathroom in a week or more, that can become very dangerous and you need to go. But when you get on top of these things and you're working with a practitioner that can help you not just manage your symptoms, but treat those root causes, you don't have to resort to these emergency medication uses, right? So back to the whole medical system treating things separately. The interesting thing with the medical system is there is a lot of research that's come out in the last few decades on the connection of the body, how the mind and the body are connected. Talking about the gut-brain connection, we've known for a long time that the mind and mental health impacts the body, especially the gut. And doctors know this. And that is one of the reasons why they prescribe antidepressants to people with chronic gut issues that may not actually have full-blown anxiety depression. Because they know that if you are struggling or stressed in some way, and we think this medication is going to kind of balance things out and give you that little bit of and feel a little bit better, that's going to calm the gut down, right? But it doesn't always work for people. And again, that side effect of the medication, a known side effect, is to have gut irritation. So they're coming from a good place. They understand the research and that there is the gut-brain connection, but instead, and then this is a limitation of how the health system works, they can't really help this, but instead of counseling you or providing guidance on how to shift your mindset or stress management techniques, mindfulness strategies, even encouraging things like walking in nature, journaling, doing things that bring you joy, your doctor's not going to sit down and give you these resources or these tools, right? And some of that is even outside of my scope. But this is where it's up to you to recognize, okay, hey, I know there's a gut-brain connection. I have been feeling quite stressed lately. What am I going to do about it? Because I know that stress is impacting my gut. right? So yes, I'm gonna try my probiotic or whatever other physical treatments you're doing, but I'm also gonna go for a walk. I'm also gonna grab a coffee with my girlfriend. I'm also gonna try a meditation. It's doing these things all together and building a gut healing lifestyle, which is why I'm so big on that, is what will make the biggest difference for you. It's not just trying a probiotic, trying a low FODMAP diet, doing this here and there and maybe only sporadically. It's doing things consistently every day to keep you in a calm and happy place where your digestion can function optimally and where we can help both reverse some of these changes in the body, but also prevent further illness. Not to say you're ever going to be stress-free, and not every day is going to be a happy day or a stress-free day, and that's okay. But when you have these tools in your toolbox, things like mindfulness strategies, and you can do things like meditation, or you recognize that your symptoms are flaring up because of, your stress level. It gives you the power to say, okay, I know exactly what to do. And not only do I know what to do to help myself feel better, but I'm not going to blame the foods I've eaten today for my symptoms. And that's a big one, right? Where the older model is, we tend to put this fear into people. A lot of practitioners online are, you have to avoid this food, it's toxic, or you have to avoid that food, it's going to cause gut issues. And the whole low FODMAP diet and the carnivore diet and all these diets kind of demonize certain foods that if you eat this, it's going to cause bloating. But it's not as simple as that, unfortunately. So the idea is we're trying to simplify the body and the digestion for people to better understand. But in doing so, and even just human nature, right? We're oversimplifying a complicated process. And it's also human nature to say, okay, I was feeling fine today until I ate lunch, and then all of a sudden my stomach was hurting. So it must have been the food that I ate. And it makes sense that you would make that correlation, right? That's when the pain or indigestion started, so it must be that food. But think about it. How were you feeling before you ate lunch? Did you have a really stressful morning? Odds are, if you did, your digestion is shut off, and no matter what you did or what you ate at that point, even if you just had a glass of water for lunch, you would have had indigestion, right? So knowing this gives you the power to stop fearing food and restricting foods more and more, and instead work on some of these lifestyle and mindset shifts that are going to help you spend more time in that optimal digestion state, which is a state where your nervous system is nice and calm. The final thing I want to dive into today is the idea that, gut issues just run in my family. So everyone in my family has IBS, so of course I have IBS, not much I can do about it. Or something more serious like, Crohn's or colitis runs in my family. So I may not have it now, but I'm going to get it, and that's just the way it is. I'm going to have to live with it. No, guys, no. The study of epigenetics is very real. If you look it up, there's a lot of research on this. Epigenetics means the genes that you are given when you were born do not determine your destiny in terms of your health, right? Yes, you might have a higher risk of developing some of these diseases, but the choices you make in how you live your life every single day, your diet, your movement, your sleep, your stress levels, all determine whether or not that gene is going to be switched on and you are going to get the disease, or it's going to stay dormant and you're not going to get the disease. So it's really up to you, and this is very empowering, right? Your health is in your hands. So knowing what you need to do to keep your body in an optimal state of functioning gives you the power to prevent some of these illnesses that you might be more predisposed to based on your family genetics. Okay, so just because you have something doesn't mean you are going to get it. So it's very empowering. And it also, for some people, it may be something of maybe hard to wrap your head around, because you may want to just be like, this is the cards I'm dealt, and what is what it is. I'm hoping that because you're here, you're not someone who's just trying to take that easy way out and be like, well, it is what it is, might as well just eat whatever I want, and it's going to happen anyway. You're someone who's like, you know what, I'm going to do whatever it takes to either optimize my gut health or prevent some of these more serious illnesses from happening. And on a related note, I'm the gut health person, but I want you to understand that there's a lot of research coming out showing the connection between gut health and things like heart health, things like dementia, things like autoimmune diseases, rheumatoid arthritis, lupus, fibromyalgia. All kinds of chronic illness is linked to the gut. Even things like fatty liver, high cholesterol, diabetes. We know now that there's a big role in gut health. So it's not just simply gut diseases like Crohn's and colitis that is linked to the gut, okay? So doing what you can today and every day to optimize the function of your gut and also optimize your mental wellness and keep your nervous system in that nice, calm, and healing state is not only going to optimize the function of your gut and have less gut symptoms, but you're investing in your future, right? So that when you work so hard your whole life for your retirement, you're actually going to be healthy enough to enjoy your retirement and travel the world and spend time with your grandkids. You're not going to end up in a nursing home, right? And that's the whole idea. We don't work our whole lives for nothing. We want to be able to enjoy it, right? Same even when we're younger. We're investing in our future, in our health. So you have to really decide, how do I want to feel, not just today and every day, but in my older years too. But most of us are motivated by what's happening now. So if you are struggling with low mood, low energy, brain fog, aches and pains, headaches, sinus issues, recurring colds and infections, optimizing your gut health is going to get you to a place where you're not having these chronic issues anymore. Not to say it's never going to happen again. We all have things that happen. We get sick, we get, aches and pains, but it's going to be much more manageable and much less often when everything is optimized. Now, here's the thing I want to really drive home to you, so you know where to invest your money wisely when it comes to choosing a functional practitioner. Maybe that's me, maybe that's someone else, but I want to empower you with knowledge to understand what you're looking for. I've had a number of people in my Facebook group, the Fix Your Gut Collective, that's my free support group, and clients that I have worked with tell me that they have spent hundreds or even thousands of dollars on things like testing or protocols with a practitioner, and either they didn't use the results of those tests to inform their treatment plan, or they just didn't make progress with their treatment with this person. So I want to give you a heads up on what kind of things to look for. I do use GI map stool testing with my clients, but not all of them. So first of all, if someone requires that you do one of these expensive tests in order to work with them, that's a red flag right out the gate. That means they don't have enough clinical experience and knowledge to treat you based on what you're presenting with and based on your medical history. I am able to work with clients based on my experience and my knowledge and my research and expertise, and without even stool testing, basing solely on symptoms and medical history, I'm able to get many people, I'd say most people, to a point of completely optimizing their gut function where they don't have chronic daily symptoms without doing stool testing. So that means we can get them there with optimizing digestive function, balancing their gut bacteria, working on optimizing their diet, their absorption of these foods, looking at their stress levels and mindset and self-care, encouraging movement, optimizing sleep, helping to balance gut to balance your hormones. I do all of these things, and majority of the people I work with get better in about 3 months or so without needing stool testing. When I do use stool testing, it is on the people that have been working with practitioners or trying different protocols for years and years. They've gotten better, they've gotten worse. They've gotten better, they've gotten worse. And they're really struggling, and they want to know exactly what's going on with their gut. So I do the stool test to inform my treatment plan. So when I get those results back and I know exactly which microbes are in your gut, I also know markers of inflammation, absorption, immune function, that directly tells me which supplements, diet changes, and lifestyle changes are needed for you to move the needle on your health. And when I do that with people, we get them feeling better pretty quickly within a month or so. So again, if someone makes you do one of these tests before even starting to work together, that's a red flag. An experienced practitioner should be able to help you move forward with your health at least 70% or so better without having to do a stool test. Some people even get 100% better. The second thing is, if someone promises to cure your gut issues for good and that they will never come back, red flag. Your body is always changing. Life happens. Because we know the mind impacts the body, it doesn't matter how much work you do on your gut bacteria or how many enzymes you take or whatever work you do, that's great. But life is going to happen. You're going to get stressed out. Trauma happens, things happen, and it's going to impact your gut. So even me, I've been on my gut healing journey for years, and I'm a professional at what I do. I still get gut flare-ups now and again, but they're much less frequent than they have been before, and I know exactly what to do to get over it much faster. Okay, so if anyone promises you that, run the other way. The other thing is, I guess that's it for that. So yeah, the testing can be useful. The other thing I would say about testing would be, don't put all your eggs in one basket. So don't assume that because you have a test that the practitioner is going to know what to do with that test. So I would always ask them before investing in the test, when we get my results, what will your plan be? Or how do you use these tests with your clients to inform your treatment plan? I'm happy to answer that question when people ask me, because it shows that they've done the research and they want to know and they deserve to know. So I will tell them, I look at the results, I look at the bacterial levels, and it tells me either, do we need to do some killing? So that's the first step in the 4R protocol. If you look that up, very common protocol used by functional practitioners. Do we need to focus on killing bacterial infections or overgrowth before we move on to repairing the gut and restoring balance to the microbiome? Or are you very low in healthy bacteria because you've done a lot of antibiotics, because you've been on a restrictive diet? If that's all showing very low and your immune function is low, which also shows up on the test, I then know we're going to skip that killing stage and move on to optimizing digestive function, repairing the gut, and rebuilding the balance to the microbiome. So bringing in more of the good stuff, okay? So if practitioner is not willing to walk you through exactly the steps that they will do when they get those results, that's another red flag. So all of this to say that, number one, doctors mean well. They are there to help you. They are necessary. But when it comes to functional gut issues like IBS, like indigestion, chronic heartburn, constipation, diarrhea, SIBO, they are not going to be able to offer you much help. And if you do use one of those medications, I guarantee you'll end up with someone like me because they have side effects and you're going to have to deal with those side effects. So again, they are there to diagnose and manage disease, not to prevent disease or to optimize the function of your body. And what I do with people is not just tinkering here and there, like medical doctors like to focus, like we said, on one system at a time. There's a gut specialist, there's an immune specialist, there's a mental health specialist, right? Together, we are taking a whole mind-body approach to healing and looking at those underlying root causes. And when we do it holistically, that's where the magic happens, because we know that your body and all systems are connected. Your body is truly an ecosystem and it needs to find balance. We can't just hit one system hard like the gut and expect everything else to balance out, right? So a lot of what I do with people is looking at their lifestyle too. Most people are burnt out these days. So we really talk about nourishing their adrenals, focusing on rest and listening to their body, honoring their body's needs, honoring their emotions, tuning into their emotions, and looking at, when I have a certain symptom, what is my body trying to tell me? Something I have learned in my journey, and part of my journey has been chronic pain, is that when I have chronic neck pain that won't go away, I have been suppressing emotions. As soon as I have a good cry, the neck pain disappears. And that is not coincidence, my friend. Okay, so there's a very, very real consequence of what we do in our society of suppressing those emotions or swallowing our emotions. Many of us, myself included, swallow emotions, push them down by having some yummy food. What happens? You develop more and more gut issues, right? It's a vicious cycle. So addressing those emotions and moving through them is crucial. Obviously, that's not my expertise or where I'm trained. So that's where I refer out to other practitioners that I trust, that I have worked with, or that I know how they work with clients and how they can support you in processing those emotions so that you can digest them, literally digest the emotions that have been stuck in your body and move forward with your healing. So without rambling on, I hope you guys found this helpful, and now you know why your doctor has not been able to help you in managing your IBS symptoms, your gas, your bloating, whatever you're dealing with. I hope that you will come join me inside my free Facebook group, the Fix Your Gut Collective. And I'm also offering a free challenge if you're watching this in March or early April of 2023. That challenge is coming up soon, so I hope you'll join me inside there. The other thing that I have recently upgraded is my Fix Your Gut Formula program, which includes step-by-step how to do that 4R protocol we talked about, supplement protocols, recipes, and a masterclass video library of trainings with myself, but also with practitioners in mindset and wellness and things like yoga, meditation, breath work, all the things we talked about today that are so very crucial as part of your gut healing journey in shifting your body into that optimal healing state. So that's why I recently revamped the program, because I thought, look, I talk about this mind-body connection all the time, and yet my program is strictly focused on the physical, diet and supplements and all of that. So I really felt the need to incorporate that mindset and mental wellness piece in there. So I hope you'll join me inside the Fix Your Gut Formula. Any other questions, feel free to DM me or email me mindfulvitalitynutrition@gmail.com. Don't forget to subscribe, and I will see you inside my group.